my name is Catherine, and I'm going to be talking about loop diuretic education for those diagnosed with congestive heart failure. Now, before diving in, I would make sure that the family members or other supportive persons are present, because I feel like there's no better time to do patient education than when they are available. Sometimes the patients aren't taking part in their own daily care. So for those who are participating, it's better if they have an understanding of the plan of care and that we're all on the same page. So diving right in, I'm going to talk about why we take loop diuretics, what to expect, what to monitor for, and what to report to the provider. So why do we take loop diuretics? Well, with congestive heart failure, you have a tendency to hold on to fluid. So the body can only handle so much fluid at one time. The more fluid we get, the harder it is for our heart to push it through our body. So what we do is we prescribe loop diuretics, and this can help flush out that extra fluid. Now, how does that extra fluid get flushed out? The best way is through your urine. So you're going to be peeing a lot, which brings me to my first point. When do you take loop diuretics? You want to take it in the morning because you don't want to be up all night peeing because you're going to miss on valuable sleep. And not to mention the risk for falls because it's dark at night. So when I would ask the patient to kind of reiterate the teaching, I would ask, when should you take the loop diuretic? And I would give them 4 answers, A through D. A being on the weekends, B being right before bed, C being right in the morning, or D only on the weekends. Clearly, C is the correct answer. So if this is selected by the patient, it would kind of get a better understanding of the understanding of the patient. Sorry, it's been a long day. Anyways, what does a loop diuretic do? Okay, if the patient demonstrates by saying, oh, it's a water pill, it makes me have to pee a lot, then that would also be a good indicator that the teaching was successful. So my next point would also kind of go along with peeing a lot would be changing of position. We want to make sure that patients are getting up out of bed and getting up out of the chair slowly because they're going to be getting up out of that bed and out of that chair a lot. Like I said, a lot. So when you get up, naturally that fluid is going to fall, okay, because of gravity. It's going to make you very, very dizzy, especially since we're already trying to flush out more fluid. So I would want to make sure that the patient would then demonstrate to me how to get up out of a chair, how to get up out of the bed. And this would kind of help me evaluate how they would do at home, especially getting up out of the chair, because then that can kind of indicate how they're going to be in the bathroom, getting up off the toilet. So I could also ask the family member, what would you do if you heard your loved one express the need to get out of bed? Would you A, ignore this statement and go to the kitchen to make breakfast? B, state, I should probably get out of bed too. C, ask, would you like any help getting up? I know sometimes you feel dizzy after getting up. Or D, go back to bed. Clearly, C is the correct answer. So if the patient were to select this, it would indicate that the teaching was successful. Next, my biggest point would be dehydration. So we're trying to flush out all that fluid, right? So because we're trying to flush out all that fluid, our main concern would be dehydration. So the signs and symptoms that you can look after would be the feeling of extreme thirst, the feeling of being really tired or not being able to pee at all, or a low blood pressure. This is all indicating of dehydration. So what you can ask the patient is to list 3 signs of dehydration. And if they were to list 3 out of the 4 that I discussed before, that would indicate that they have a pretty decent understanding of the information that I had taught previously. I could also ask the family members, how can dehydration present itself? And if the supportive person says, oh, well, if I notice that they're very confused or that they're very tired all of a sudden or some kind of change of mood or appearance, then that could also indicate an understanding by the supportive persons. Now, I did bring up low blood pressure earlier when it comes to dehydration. Blood pressure monitoring is very important for these patients, especially before taking a loop diuretic. So what I would do is I would bring in a manual blood pressure monitor. They have electric ones at the store, so hopefully they have those for these patients because it could be a little bit easier maneuvering it. Otherwise, if not, I could take a manual and teach them how to use it, or an electric one, whatever's available at the hospital, and then do it on myself, teach them, and then have them teach it back for me. And it would be really good that the family participate in this activity as well. The next main point I want to discuss is the kind of diet that we want to watch out for these patients. When we're flushing out those fluids, we're also flushing out a lot of electrolytes. Electrolytes are very important for our body, specifically potassium, which with loop diuretics, we're flushing out a lot. So potassium has a huge effect on your heart. So we want to make sure that these patients are eating a lot of potassium-rich foods. So what I have is little pictures here. So I would show the patient and the family members different pictures of potassium-rich foods, and I would ask them, pick which one. Clearly, avocado is the most potassium-rich out of the steak, the pork, and the French fries. So if they pick avocado, it would mean that the family and the patient have a firm understanding of the information moving forward. So the last point I want to discuss would be daily weights. Daily weights are very, very important for these patients with congestive heart failure and who are taking loop diuretics. We want to make sure that the loop diuretics are working. So what I would want to ask the patient is, or what I want to tell the patient is that the patient should not be gaining any more, no more than 2 or 3 pounds a day. 2 pounds can indicate 1 liter of fluid has been accumulated or added to their already overfilled system. So that needs to be reported to the provider immediately because that means something needs to be adjusted, whether or not it's medication or other therapies that we're implementing or we're trying to do for the patient. So what I have is I have a scale here, and what I would teach is the importance of zeroing out the scale before stepping onto it. So if this were to turn off, then I could show you. But before getting on the scale, you wanna turn it on and wait until you see the 0. As soon as you see the 0, you can step on it, and that is because it will give you the most accurate reading. So of course, after explaining this information, you can have the patient demonstrate the scale for you, have the family member participate in making sure that they're doing it right as well, and that they're understanding the concepts. You can ask both the family member and the patient, what's the importance of zeroing out the scale? And if they say that it gets the most accurate reading, then that would demonstrate that they have a very firm understanding of the scale and the reason for the zeroing. But yeah, and you could also ask them, what can you report to the provider when it comes to daily weights? A, you gained 0.5 pounds. B, you gained 1 pound. C, you gained 2 pounds. Or D, you gained no weight at all. Clearly, 2 pounds would be the answer. And if the patient or the family member were to answer this, then that would mean that they have a firm understanding of the material. Now, I really liked the idea of discussing each topic and then kind of quizzing them as I go along. But then I like the idea of coming back afterwards and reiterating it and going through again, maybe switching up the questions, adding more, just to see and make sure that they are indeed understanding the material. But otherwise, I think that's it on loop diuretic education. Thank you so much. Again, Catherine Whitford.